everybody. This is Amanda Pratt, licensed clinical social worker with Imagine Life Therapy, and today I want to talk to you a little bit about a diagnosis that I think can be very sensitive for people with chronic illness, and this is called somatic symptom disorder. So a somatic symptom disorder is a diagnosis that is commonly given to people with chronic illness who experience that they maybe see a doctor and the doctor runs tests and can't find any medical explanation for their symptoms. And the other requirement to fit a somatic symptom disorder is that the symptoms must be persistent for more than 6 months, and that they have to have significant thoughts, feelings, or behaviors excessive associated with those health concerns that are usually manifested through a disproportion to their symptoms, a high level of anxiety about their health in general or their symptoms, and excessive time and energy devoted to these symptoms or other health concerns. Now, being a clinician and a person with chronic illness myself, I have a mixed bag with this one, but ultimately some really kind of yucky feelings about it, for lack of a better term. So a couple of the problems with the diagnosis somatic symptom disorder is, number one, this is going to disproportionately affect women because women have historically and routinely been dismissed when it comes to health concerns and labeled as things like histrionic or hysterical, which unfortunately people are still using these terms, and they're just not taken as seriously. So this diagnosis is going to disproportionately affect women. Number two is that if a doctor is referring you to a psychiatrist or a clinician who then diagnoses you with this, they may stop investigating your medical symptoms, which then essentially leaves you to shifting your treatment focus to your cognitive symptoms only. So the somatic symptom disorder in the DSM-5 is rated based on how distressing your cognitive or emotional response is to your physical symptoms. It's not addressed at treating the physical symptoms themselves. So one of the ways that this can be harmful is that this is also going to disproportionately affect chronic pain patients. And since a lot of this is subjective, like excessive time and energy. So what is excessive for someone who's experiencing chronic pain or chronic fatigue or chronic GI issues or whatever the symptom is? Who is determining what's excessive and what's not? What is considered excessive thoughts, feelings, or behaviors associated with your health? I mean, if you have a chronic health problem, whether you've received a diagnosis or not, it's going to affect every area of your life, okay? So that is going to lead to you disproportionately having to devote more energy and time to committing to reducing these symptoms, to trying to make yourself comfortable so you can enjoy life again, because that is the nature of physical symptoms. If you think about it, the way that our body works and our thoughts, feelings, and behaviors is that our thoughts and feelings are meant biologically to help us have attention or put attention towards something that could be harmful to us. Physical symptoms do the same thing, right? They are supposed to be alerting us to something that could be harmful in our body so that we pay attention to it and do something about it. So by basically telling someone we're only going to address the cognitive aspect of physical symptoms is, I think, counterintuitive to the purpose of physical symptoms. But the other thing is it really can lead people to basically saying or assuming that the physical symptoms are being caused by the mental or cognitive symptoms, which isn't necessarily the case, okay? I think that on the flip side of this, as a clinician, if you look at this diagnosis objectively, it's really very simple and there are some benefits to it. Any diagnosis, as we know in our culture and the way our systems work and institutions work, especially with healthcare, we are required to have some sort of diagnosis in order to justify your insurance paying for your treatment. So if you come in with a chronic illness and you're trying to get support, which of course seeing a therapist can really help you manage and cope with physical symptoms, especially if you haven't received a diagnosis yet. That's often the most distressing time of chronic illness, right? So if you go in and see a therapist and get diagnosed with a somatic symptom disorder, it's going to allow you to get some sort of help with learning how to cope with your physical symptoms better, which might put you in a better position to advocate for yourself, right? Even things like learning to reduce your stress, as you all know that I'm a big advocate for, can really help reduce physical symptoms. So it's kind of this weird cycle where, of course, a diagnosis in and of itself, objectively viewed and responded to, is not inherently stigmatizing. It is our culture and the way that we respond to a diagnosis that makes it stigmatizing. And unfortunately, this is one of those diagnoses that can lead to stigma and lack of treatment, medical treatment for people. And of course, it's going to disproportionately affect certain groups. So I have a hard time with this diagnosis. Any of my clients that come in and see me and have a diagnosis of this already, we talk in depth about all of these issues that come up. And also, because it's so vague, it really could apply to most of us with chronic illness. I mean, I could probably be diagnosed with a somatic symptom disorder myself. I fit the criteria. I do spend a disproportionate amount of my time thinking about how to manage my symptoms. I have had symptoms that are persistent for more than 6 months, 6 years now. And of course, I've developed some high levels of anxiety around certain symptoms due to the unpredictability of them, because that is the nature of anxiety. And I spend a lot of time and energy devoted to my symptoms and health concerns, because that, to me, is the best way that I've been able to manage my illness. So I think that it's one of those things you have to take with a grain of salt, and it's really something that I think has a benefit for some people, and especially if you're trying to get care and support and have insurance cover it. But again, these are all issues that I wanted to bring up, and I'm really curious about how you all feel about the diagnosis of somatic symptom disorder. Do you disagree with me? Do you agree with me? I'm really curious to hear what everyone else's perspective is on this, because I kind of ride both sides of the fence as a clinician and a chronic illness patient, but I would love to learn and hear more about what you all think about it. So please feel free to comment below about what your thoughts are on this, and any other questions or concerns you'd like me to address in a video. I'm happy to do that as well. So I hope you all have a great day. And again, this is Amanda Pratt, licensed clinical social worker with Imagine Life Therapy.